What do we got here? I don't know what we're doing. A lie can travel halfway around the world while the truth is putting on its shoes. Mark Twain. All right. Good morning and welcome to another morning episode of the Liberty Dad podcast. Apologies for that weirdness there. I have no idea what was going on. I got some new settings in StreamYard here, and apparently I had played with a couple of them and got them out of sorts, but I think we're back. I think we got it back in order now. So we're good. All right. So goodness, what a way to start the show, right? Like with this weird looking video. Anyway, welcome to another morning episode of Liberty Dad podcast, discussion on politics and culture. If you're tuning in live, thank you so much for giving me your time early. Folks, do me a favor. If you enjoy the show, please be sure to like and subscribe to my channel. And for the really serious folks out there, hit that bell so that you never miss an episode. All right, today we are going to talk about, we're going to discuss RFK Jr. Now, look, I didn't want to talk about Trump's cabinet and administration picks. Wasn't really too interested in that. Everybody's talking about it. But I saw some things and I just was like, okay, I can't resist. It's in my bones. I had to respond to these two things. And they're relatively significant. So we're gonna discuss it. So if you haven't heard, RFK Jr. is going to lead the Department of Health and Human Services, and it's creating a lot of buzz. But unfortunately, DL, Liberty Dad here, I'm going to be the buzzkill by setting the record straight. That's what I'm going to do. So we're going to answer two questions today. Number one, is RFK Jr. a libertarian? And this will be the big one. Is RFK Jr. responsible for a 2019 measles outbreak on the island of Samoa? That'll be interesting. It's going to be a lot of fun to get to. All right, so we'll start with RFK Jr. being a libertarian. Recently, Angela McArdle, the chair of the Libertarian National Committee, she posted this in response to Donald J. Trump saying, "I'm thrilled to announce Robert F. Kennedy Jr. as the United States Secretary of Health and Human Services." And then he goes on to say a little bit more. Angela says, "Robert F. Kennedy Jr. is a member of LP National. We are in a joint fundraising agreement with this campaign, and he spoke at our national convention and the Libertarian Party of California convention. He's not the libertarian we were thinking who would represent us, but are we getting two libertarians in the cabinet?" Right? So there's the implication that he's a libertarian. So let's address this. Well, first and foremost, as a rule of thumb, I avoid deciding who is and is not a libertarian. For the biggest reason is I just find it unproductive. Like everybody, it's the whole, are you a real man? Are you a real woman? If you're a real man, you would do this and that, whatever this and that is, right? And I just find them unproductive. Instead, I generally prefer to evaluate their positions. I say, okay, all right, what is your position on this? What is your position on this? And then we walk through them, because I will determine whether or not a position on a given topic does fall within the boundaries of being called libertarian. So let's get a simple definition. I love my simple definitions. So here is my simple definition for libertarian. Super easy. Anybody can get it. You can memorize it in like 30 seconds. Right there. Libertarian, noun. Someone who believes that each individual owns their own self, that is self-ownership, and who seeks to maximize each individual's autonomy. Super simple definition. It's broad, right? Like a lot of people would fall into that. And the reason I do this is because DL as a libertarian in 2024 is much different than DL the libertarian in 2017. I have changed over time. I have what you might call, or you might say, I've become a better libertarian. I understand the principles more. I've reconciled my positions with my views in a much better way, what people might consider to be more consistent. So if you go back to 2017 and you talk to DL and you say, tell me about libertarianism, I'm going to generally be about the same as I am today. I'll describe it, I'll articulate it much better today. But if you start asking me about particular positions, you're going to find that some of my positions have either changed slightly because I've reconciled them, and maybe I couldn't let go, or I have come to understand the libertarian position better. What it means to be a libertarian. And in 10 years, I will expect that I can look back and say, well, back in 2024, DL was saying this, and here's where I am now. And presuming that I'm still libertarian then, I will most likely have moved forward. And this is the same as anything, right? Like when you're 18 and you become a man, you are not the man you are, hopefully, when you're 30, 40, 50, and so on. You mature, you get better at it. Same thing in sports. My son he likes to play soccer. He's 5, and he's pretty decent for a 5-year-old. However, when he's 10, if he's still playing soccer, he's going to be way better. He is still a soccer player today. And if he's playing soccer, when he's 10, he will be a soccer player then. However, we will be able to evaluate the improvement in his playing. But nevertheless, we'll say, you're a soccer player. You're a soccer player. 5 and 10, so on. Right. And this applies to any one of these designations that we want. Real man, soccer player, are you a musician? Just anything. It applies to anything. You start with the rudimentary basic definition. And then rather than saying you're not a libertarian or you are a libertarian, just say, all right, what expectations would we have for a libertarian, right? What are the basic ones? What are the ones that are applicable when you're brand new or when you're seasoned? Like, what is the definition that applies to both? That's how I approach it. And so that's why I got this simple definition of what is a libertarian. And there are libertarians that I know that I'm like, yeah, you're not really such a good one. I mean, you're a libertarian. I'll give you that, but you're not a good one because you haven't reconciled all these, all these issues, all these positions that you have. You need to have a come to Jesus moment. So that's how I define it. Okay. Now let's move on. Because libertarianism at its simplest, libertarianism is about self-ownership, and every position either submits or is in violation. However, you can have multiple positions, right? And so let's just take 5 positions. Like, okay, maybe 4 of them you're really great on, but the 5th one you haven't come around to it just yet. And so you're not as good as a libertarian, of being a libertarian on that one particular issue, right? And if you're brand new, it might be instead of having 4 out of 5, you might have 1 out of 5. You're the baby, right? You just came into it. So this is what I mean. Like, we need to evaluate based on positions. So I look more at the totality of positions. Now let's address something else. For my libertarian audience, you already know this. But if you're not a libertarian, there is this distinction that we have between big L libertarian and small L libertarian. The big L basically means you are a member of the party. You're an official card carrying member of the party. Small L is more like what I just described. A small L libertarian can be also a big L libertarian. And it's possible for a big L libertarian not to be so much of a small L libertarian. Follow me on this? Like, somebody could join the Libertarian Party in theory and not really be a libertarian based on the positions that they hold. They might be mistaken, any number of reasons. We don't need to really try to go through. But this is a distinction that everybody needs to be aware of. My libertarian audience already is aware of it. So, you guys are good. So the question is RFK Jr. a big L libertarian? Is he a small L libertarian? Well, when it comes to big L libertarian, the chair of the party is correct. So let's play a quick video here. Here we are.
Microphone 1.
All right. So let me pause it right here. This is from our national convention back in DC. And what was it, May? I think it was in May of this year. So it was back in DC. This is where we elected new officers. This is where we elected elected the nominee for president, which means all the nominees were either present or, gave speeches, had people on their behalf, so on and so forth. So this is the nomination portion of the meeting. And I want you to listen very carefully here.
Good morning, Madam Chair. My name's Nathan Romig, and I'm from Pennsylvania.
And I'm Hector Roos from Florida.
And we would like to nominate Robert F. Kennedy Jr.
The single most...
Now, did you hear that? Loud boos. Continue on.
Important anti-two-party system candidate we've seen in our lifetime.
One moment. Settle down, settle down, settle down. And they have nominated Robert F. Kennedy Jr. And he is a member of the Libertarian Party.
He
Correct.
is, Madam Chair, as the Credentials Committee Chair, I can confirm that he is a basic sustaining member.
He is a basic sustaining member, and it's my understanding that he did turn in nomination papers that had the required amount of signatures on them.
All right. So the question of big L libertarian is pretty much settled. He is a bona fide member of the Libertarian Party. Now, when did he become a member? I don't know. And I don't think it's very relevant, to be honest with you. Now, the question of the small L libertarian, I'm not willing to make that assessment. However, I will point this out. I haven't seen very many positions that he holds that libertarians hold as well. And the significance of the booing kind of suggests that most of the delegates didn't see him as a libertarian either. And he ended up, he did get nominated, he did get on the ballot, and he lost in the first round, getting only 19 votes out of roughly about 1,000 potential. So we got 19 votes out of about 1,000 delegates who booed, not once, but twice, loudly enough that it was picked up on all the microphones so that it could come through. Right. So it was a significant booing. Also, I was present, so I remember it very distinctly. So it would seem that the delegates also didn't see him as a libertarian. Okay. Now, why is that important? Because when you look at the audience, the crowd of libertarians, if it's just one person, if it's one guy who's like, hey, this guy's not a real libertarian, whatever. But when you seem to have a consensus that somebody does not fit the bill, maybe that's worth listening to. Now, whether RFK Jr. Will lead the Health and Human Services Department well is irrelevant to whether or not he's a libertarian. He could be great at it, right? Like, it's yet to be seen. But it is fair to say that based on the totality of his positions and the poor response from the very delegates who reelected, like these are the same ones that reelected Angela, who said that, it's fair to say that he does not fit the expectations for the promise of a libertarian in Trump's candidate. And I think that's important. So this whole idea of, are we going to get two? No, we still haven't gotten one. Okay. And this is not just Liberty Dad saying he's not a real libertarian, rah, rah, rah. whatever. I'm simply judging based on the audience, the same audience who elected her, the nominees, you know, like all that. Like the crowd has spoken already. They don't see him as a libertarian. It's inappropriate to call this a libertarian win. However, he may do very, very well. In fact, I think the shakeup might actually be worth it. Like having him in there, regardless of whether we consider him a libertarian or not. I think it's probably going to be a good thing for RFK to be there. As I said on Twitter, I said something to the effect of, America is fat, unhealthy, and what was the other one? Fat, unhealthy, and like leads in America. You know, what did I say? Fat. There were three things that I said. It was fat, unhealthy, weak. That was the other one. I said we're weak, we're fat, and we're unhealthy. And then I went on to say that the United States has one of the highest rates of mental health issues for developed countries. One of the highest rates. Like maybe the Health and Human Services isn't doing so well. I mean, we're not in good shape. And I know everybody's going to be focusing on like, oh my God, he's a vaccine denier, blah, blah, blah. You know, there's more to health than just vaccine, people. Like there's more to health than just that. There's a lot that's involved in health. Washing your hands. If you go look up the history of hand washing, that one thing probably did more to save lives than most anything else. I'm not joking. Go look it up. Like there was and I don't have the article handy, but there was an article that talked about hand washing in the hospital, and they were having trouble getting doctors into proper compliance. And they were I remember where it came from. It came from the book Freakonomics. And so they were talking about this study that was done on hand washing, and they were trying to figure out like how do we incentivize doctors to wash their hands more frequently, because it has long been understood that hand washing, washing your hands, contributes to better health, particularly in a hospital environment. And so one of the things they tried monetary incentives, and that didn't really work so well. And then they did something really interesting. They took the screensavers of all the computers in the hospital, and they put on there like some picture of germs or something like that, really big, so that every time a doctor would come to the computer, they would see like all these germs and everything, and it would be like a message to remind them to wash their hands, right? And so and they saw a huge increase in hand washing. You know, so like this has, and I'm telling you, if you go look it up, it's a huge deal. So there's more to health than just vaccines. However, that brings me to my next question. Is RFK Jr. responsible for a 2019 measles outbreak on the island of Samoa? Well, let's check out this video clip. This comes from MSNBC, and we're going to pick it apart a little bit because that's what I like to do. So let's check it out.
There is a ton of news to get to this evening, but I want to start by going back to the year 2019 on the small island nation of Samoa. That year, 1 year before the global pandemic, Samoa was experiencing its own pandemic.
This is the biggest increase in deaths we've seen since records began. The figure of 32 dead is up from 25 only yesterday.
These hospitals aren't designed to deal with this, and I think the minute you're getting hospitals running at 200% and 300% capacity, I think that speaks for itself. It's incredibly serious.
The outbreak that doctor was talking about there was measles, a disease for which vaccines have been available for more than 60 years. But in 2019, an entirely preventable outbreak on Samoa killed 83 people, most of them children under the age of 4.
Okay, so let's pause it right here and let's see, is this factual? Now, I want you to pay attention to the framing here. So she says measles, you know, it entirely preventable for 60 years, and then they've got this ominous picture of RFK with the words anything goes underneath of him, right? So they're talking about this measles outbreak, juxtapose this ominous picture of RFK as if like it's leading you to believe he caused it. So let's start with the basic facts. You know, and we're gonna go over here to this article This is from the World Health Organization, and this comes back to us from 2019 December. Okay, so we're going to go down here, Samoa, and it says, and I'll make it a little bit more bigger. There we go. Let's back it up a wee bit there. All right. I think that's sufficient. On 16 October 2019, the Samoa Ministry of Health declared a measles outbreak, with the state of emergency being declared on 15 November 2019. From 1 January through 4 December 2019, a total of 4,217 confirmed and suspected cases, including 62 measles-associated deaths, have been reported, with the majority of cases reported among children under 5 years of age. And we'll read this, but we'll probably come back to it again. In 2018, WHO and UNICEF estimated the national routine immunization coverage for measles containing vaccine first dose, MCV1, and measles containing vaccine second dose, MCV2, to be 31% and 13%, respectively. We'll come back to that in just a moment. So it would appear that this media clip is correct. And I probably lost my... give me just a second here. We're going to go right back to the video, and we're going to continue watching. So we've validated that there was a measles outbreak. All right, let's see here. Why is it being difficult?
There is a ton of news.
All right, hold on. Let's scroll back up. I had the wrong setting there. All right, let's continue.
Of 4. Why? Why was a preventable disease spreading like wildfire and killing so many children? Well, 1 year prior to that outbreak, 2 infants in Samoa died after nurses accidentally mixed their vaccine doses with another drug. It was a horrible tragedy, and it was one the American anti-vaccination movement sought to exploit.
Okay, so this is the why now. Okay, she's saying, hey, the anti-vaccine movement exploited this issue. Now, it is true that there was a mix-up and 2 children, and it caused a bit of a problem. Okay. However, there is a timeline problem, and we're going to get into that in just a second. Let's play a few more seconds of this.
The anti-vaccine group Children's Health Defense jumped on the incident to stoke skepticism about vaccines in Samoa. And during that time, measles vaccination rates for infants in Samoa went from 92% in 2013 to just 40% by 2018.
Okay, so we're going to pause it right here because they're continuing to paint this picture, but there's a timeline issue. Number one, in 2019, okay, so in October 16th, 2019, the Samoa Ministry of Health declared a measles outbreak. And in February of 2021, the Samoa Observer reported RFK's visit, which happened on June 1st of 2019. That's their Independence Day, by the way, just for the record. All right, so let's take a look at that really quickly, because what I want to do is I want to kind of show you how the media is being misleading. So we're going to go back to the web, and I was able to pull up the same article that they showed you a moment ago. Now, unfortunately, it's behind a paywall, and I was unable to find any record of it not behind a paywall, like, Internet Archive and all the places. But this is the same picture that they used, and we can see, you may not be able to see it down here. It may be hard to read, but it says Robert F. Kennedy Jr. with Prime Minister, I cannot pronounce his name, at Independence Day in 2019. I looked up their Independence Day. It is June 1st. Okay, so that's when this picture was taken. That's when he was there. He was in there in June of 2019. But she just said that they jumped on this, okay? And they caused this outbreak. The outbreak that happened in October. So just a few months later, okay? And then what's interesting is a world-leading anti-vaccine advocate says he believes the prime minister had doubts about the safety of vaccinations months before a measles outbreak claimed 83 mostly infant lives. So luckily I was able to grab that line before we hit the paywall, because in the media clip, she said that RFK confirmed it with the prime minister, but that he said this is what the prime minister told him. But here it's slightly different. There's a little bit of nuance here. It says he believes the prime minister had doubt. That's an entirely different thing. If you tell me something and I say, Fred told me this, then I am making a very specific claim about what you said. However, if I come out and I say, I believe that Fred had doubts, then I'm not, then Fred hasn't necessarily told me anything like very specific. But what Fred might have done is told me some things that led me to this conclusion. So two entirely different things. Now I'm nitpicking here, and you might argue and say, okay, now you're digging down a little bit deep. But again, this is the news reporting. We're reporting whether or not RFK had anything to do at all with the measles outbreak in 2019. Now, I want to point out that the outbreak occurred in October. He was there in June. So first and foremost, ask yourself, how many lack of vaccines would cause an outbreak between June and October? Like, how many really? Probably very few. It's not to say none. Like, it's possible if you don't get your vaccine in, I don't know the exact time frame on measles in terms of how long does it take to go into effect. But let's just assume that you take it in June and then by October you would be good. How many people missed out? Like, probably very few. So right there off the bat, it's unlikely that as according to the news, that he had anything to do with it. But there is more. So let's take a look at this. Where is it here? Let me get back to my screens. All right, so we're going to pull up this PDF, and maybe I'll kind of zoom in on it a little bit so that you can see it. All right, and let's move some things around here. There we go. All right, so this is a chart. So this is information from the WHO and UNICEF on MCV1 for Samoa. Okay, you can see it right at the top there. Samoa, MCV1, and hopefully you can see the chart, but I'll zoom in just a wee bit more so that we can get as best of a view as possible. So on the left here, we have our vaccination rate, and then we have our timeline starting in 2011, going through 2022. So as you can see here, right here, where you've got like kind of off to the right, their lowest point is in 2018. 2018, before Robert F. Kennedy made it to Samoa. And we can see that it was already declining in 2017, 2016. It flatlined from 2015, but it also was declining from 2014 and from 2013, their highest rate. So as you can see, their rate of vaccination for MCV1, the first dosage, was already declining before they had their outbreak. And then they had their outbreak, and we see that it kind of shoots back up. So people probably got scared and went and got their vaccine, right? And so I think that, the media has basically told us a flat out lie, because they're painting the picture that RFK is responsible for this outbreak. And if you think I'm done, well, I'm not. But let's continue watching this video. Let's see if there's anything else that we can glean from it. So,
the man in charge of that anti-vaccination campaign, the leader of Children's Health Defense, was Robert F. Kennedy Jr. He personally traveled to Samoa as an honored guest of the prime minister. Kennedy told the local papers that the Samoan prime minister shared Kennedy's concerns about vaccines. And right around that same time, the prime minister halted the country's infant measles vaccine program.
wow. So they are painting this picture. I got a little ahead of myself, but they are painting the picture here that, hey, he traveled to Samoa, and then right about that time, they suspended the campaign for vaccinations, and so therefore the logic that they're trying to apply is that it's RFK's responsibility. Like, he's the one that did it. He traveled there. He convinced the prime minister um, that he should suspend it, and then the prime minister did, and RFK is happy. Children die. That's the picture they're painting. Let's continue. We got a few more seconds of this.
All of that created the conditions for Samoa's deadliest measles outbreak in generations, which resulted in the deaths of dozens of the island's children. And the man who ran that deadly anti-vaccination campaign has just been named by Donald Trump to be the next Secretary of Health and Human Services, where he will oversee everything from vaccine and drug approvals to children's health to the Center for Disease Control and Prevention.
Okay, so there it is. RFK is responsible, according to MSNBC. This is not some rag. I mean, depending. Yes, it is, but no, it isn't, right? It is a mainstream media outlet. And yes, there it is. This is why legacy media is dying. And if you're willing to tell the truth, podcasting is the news of the future. I am the news of the future. I am the future. Okay. Dr. Fauci is science. I am the future. But again, going back to this. So they're painting this picture that it's RFK's responsibility. Now, I love going back and looking at articles in the past, because I like to see, like, what are articles in the past? What do they have to say? It's one thing for a news outlet to go and dig up a few articles, throw some screenshots up there, and then say, oh, look, this guy's responsible. How dare he? And I can't believe that he got this new appointment. How dare Donald Trump do that? Like, we're all going to die, right? Like, this is what's going on here. Well, as it turns out, when you go back and you look at some of the media back then, you find out that there was nothing. And I'm going to put these up on the screen for you really quickly here. So this is from the BBC, and this is December of 2019. It says how a wrong injection helped cause Samoa's measles epidemic. Okay, if you read this article, there's no mention of RFK Jr. or the ministry, or what was the Children's Defense Organization, whatever his nonprofit is. I can't remember the name of it now, but there's no mention of either one of them. And this was in 2019. Why is there no mention? Probably because he had nothing to do with it. Probably because the media doesn't have a narrative that they want to paint now that he's getting a position at the federal government. Like, there was no reason to come out against him then. There is now. I mean, they could argue back then and say, hey, this guy's spreading misinformation. This vaccine information isn't incorrect. So they might have had an incentive on that front, but there was no incentive necessarily at the time to correlate his work there specifically with this exact event, because BBC didn't report it. And if you go over to Vox, it was not exactly friendly to, anybody that's leaning even slightly right wing. If you go to Vox, they had an article, Tiny Samoa has nearly 5,000 measles cases. Here's how it got so bad. The island nation saw 70 measles deaths so far this year, most in children under the age of 5. Again, this was December 2019. Okay. Now remember, the outbreak was declared a measles outbreak in October. And so in December, news outlets are reporting on it, and they don't mention RFK at all. They don't say, man, I can't believe that RFK did this. But today they are. And they're coming just short of saying RFK is responsible. Like, they didn't actually utter those words, but the narrative, the picture that they painted did. And they were wrong. And they should be held accountable because it's misinformation. And we all care about misinformation, right? This is, as I was listening to a podcast the other day, Dave Smith. Most of you probably know him. And he was talking, and he said something to he was responding to Sam Harris. Sam Harris was basically like, I can't believe people are listening to a comedian. Now, Sam Harris is supposed to be this intellectual giant, and Dave Smith is supposed to be this dumb comedian, right? Like, that's the picture that's painted of these two guys out there for people that are like on the left and whatnot, right? The people that disagree with Dave and agree with Sam Harris, they're going to be like, man, Sam Harris is an intellectual giant. Look at his accolades. Look at all the work that he's done. And this guy, he tells jokes for a living. And so Dave made this really interesting point. He was like, you guys are so intellectually bad that somebody like me, a comedian, can upstage you intellectually because I read. And that's all it took. Like, that's what I did this morning when I watched the clip and I said, wow. And I looked at their media clips. I watched the video, and then I looked at the media clips that they had in the video, and I looked them up, and then I looked up some more information. And about an hour and a half later, I realized MSNBC is full of it. They completely lied. 100%. They made up a narrative to all of their audience, and they will likely not be held accountable because unfortunately I'm not big enough to compete with MSNBC yet. But this is what I do. So get the word out, let people know, tell them, hey, if you want the truth about things more objectively than what you're getting, come see me because I'll give it to you, whether it's about the Libertarian Party, whether it's about MSNBC. I'm going to give you the truth as best as I can. I'm going to cite my sources. I'm going to give you dates. I'm going to look up things historically, and I'm going to package it together, and I'm going to be upfront and honest. Every one of the links that I showed you, they will be in the show notes. I was running a bit behind, so they're not there just yet, but after the show, I will add the rest of them. There's not very many. And you can go look everything up, and you can see, wow, DL was right. This podcast bro who's working out of a 10 by 10 office with some, with a couple $1,000s worth of equipment, nothing at all compared to what MSNBC has. In an hour and a half, he was able to dig up and identify that MSNBC got it wrong, not by mistake, on purpose. They purposely misled people. That's what you're getting from me. You're getting that kind of truth. And it's not that hard. All I did, just like Dave Smith, I read. I read and asked a few questions. That's it. And I'm not even making an assessment on whether or not you should or should not take the measles vaccine. All I'm saying is that there was a clear decline long before he ever stepped foot in Samoa. And at the time, reports did not point the finger at RFK. But now that it's politically expedient to do so, they are. And there's plenty of arguments. I've seen it. I've seen it all over Twitter. Like, oh my God, he's an anti-vaccine. Samoa. Go look it up on social media. Just type in RFK Samoa. You'll find plenty of stuff because it's out there. People are already talking about it, and they're wrong. So here's today's episode for you. Okay, let's get to a few comments here. Let me scroll through and see. Here, Libertarian JRT, Big Food blames everyone except their basic business model and falsified research. I agree. They got some, like, eating healthy is not really that hard, right? Like, what's that saying? It's from Michael Pollan. I think it's Michael Pollan. Eat food, not too much, mostly plants. That's his health advice. And as a rule of thumb, that's a pretty good one. Like, you will generally be healthy. And what that means is eat real food, not processed crap, not too much. So don't overindulge, and mostly plants. So you can have some meat, go have you a steak, and have you some green beans and maybe some potatoes. Bam. And if you cook it like from scratch, bam, right there. You've got a good recipe for decent health. Now, is that going to work for everybody in all situations? Not necessarily. Will some people benefit from other types of diets? Possibly so. But as a rule of thumb, that's eating healthy is generally pretty easy. And so we don't need all this garbage that we have. All right, what else we got in here? Let's see. What else? Let's go through. Joe Hanush asked, did the government ban it or remove the jab mandate? I think he's talking to me. And if you're talking about Samoa, then I believe the answer, I believe the answer to that is that Samoa suspended it after they had 2 vaccines that were mixed up. Like some nurses made a mistake and they injected kids with like muscle relaxer or something like that, and those kids ended up dying, and then that freaked everybody out. And I had another clip that I wanted to point to you guys, but on the topic of vaccine hesitancy and skepticism, the truth of the matter is there was skepticism in the medical community overall before COVID. COVID did, it reinforced some vaccine hesitancy, specifically with the COVID vaccine. However, there was hesitancy long before that. So there's a book called When Doctors Don't Listen. It's by Leanna Wen. You might remember her. That's the crazy Asian woman that was all over the media during COVID in like 2020. And she was like, we need to lock people down, and we need to use a carrot and a stick, and we need to hit them with a stick and take away their freedoms. Like, she was pretty bad when it came to policy. However, years before that, she wrote this book, When Doctors Don't Listen. She co-authored it with another doctor. And the entire book is about how the medical community doesn't do a good job of diagnosing people. And she gives some interesting stats in there. She points out that studies in the 50s, 60s, 70s, and all the way up into the 2000s, they repeatedly confirmed that roughly 80% of your diagnosis can be determined from your story. So you walk in, you talk to the doctor, and you tell them your story. You're like, I was doing this, and this happened, then I felt this, then I did this. You tell them the whole story of why you're there. Long story, right? 80% of diagnoses can be determined from that story, is what she points out. But then she said, how long do you think it takes before a doctor interrupts you? And she said recent studies had shown that it's about 11 seconds. It's an average of 11 seconds. And she asked this really pertinent question. She said, how well can your doctor diagnose you from your story if you're getting 11 seconds to tell it before they start interrupting? And so she's pointing out this fundamental flaw in the system. And that fundamental flaw is that patients don't have enough time to sit and talk with their doctor. So therefore, the doctor does not get adequate information to make a proper diagnosis. And that leads to incorrect diagnosis. And it also leads to a plethora of tests that are often unnecessary and could have been ruled out long before that. And so it was a really, really interesting book. But again, the issue of medical hesitancy, that has existed long before COVID and side by side with vaccines. And so when you have an incident like 2 children dying because they were given the wrong injection, but these same 2 children died, and it at first seems like it came from the vaccines. When you add people's already existing medical hesitancy with the fact that the medical community has made number of errors. It used to be that that they were it was the 3rd largest cause of death behind cancer and behind heart disease. 3rd largest cause of death, medical errors. And so people were rightfully skeptical of their doctors. And so when you add a situation like that, yes, people are going to be like, whoa, I don't want my kid. I don't want my kid to die from taking a vaccine. And if you remember the chart that I just showed you, that showed a huge uptick after 2018, right? Why did that happen? Well, probably because the measles outbreak, and then people started getting vaccinated again because they're like, whoa, I don't want my kid to die, right? So people fluctuate. This is the point. And we have to have these honest conversations, and we've not been having them. Now, hopefully, with RFK going to the HHS, hopefully we'll start having them. Will we get some things that are maybe not correct? Maybe. But as I said before, America's weak, fat, and unhealthy, right? We've got all sorts of diseases. We're we're one of the top for mental health disorders. Like, we're in bad shape. So as far as I'm concerned, I don't know that we can do any worse. Hopefully we can do better. All right, folks, that's my show. Hope you enjoyed it and found it informative and inspiring. Be sure to catch me Monday through Friday, 7:30 a.m. for an informed discussion on politics and culture. Make sure that you're subscribed to my YouTube channel, Or if you prefer my Rumble channel, you can go to youtube.libertydad.com or rumble.libertydad.com. While you're there, let me know how I'm doing by leaving me a comment. Last but not least, I want you to remember, if you're a champion of liberty, your business is people and your product is liberty. I want you to have a great week and weekend. But for now, I'm going to have to catch you later because I'm out.